Good afternoon, everybody. Welcome to today's training. We are doing a training on the Morris County Coordinated Entry System. I'm joined today by Maria Fadali, who is the social work supervisor at the Office of Temporary Assistance. If I got that wrong, Maria, please correct me. You're taking yourself off mute, so I feel like I got it wrong.
Yeah, it's administrator, but yes.
Okay. Thanks, Maria. Importantly for this conversation, she is the lead chair of the Morris County Coordinated Entry Case Conferencing Committee. She sits on the Coordinated Entry Leadership Committee as well. I am Allison Del Calzo-Barris. I am the program manager for the Sexual Health Center of Morristown Medical Center. I am the CoC Executive Committee Chair, and I also sit on the Coordinated Entry Leadership Team. The purpose of today's training is to provide an overview of the Morris specific CE system. We assigned a prerequisite for this training, which can be viewed on the HUDexchange.info website. It's about a 90-minute training that provides an overview of what coordinated entry is in a national level. As you can see on the slide in front of you, without a coordinated entry system, there may be confusing or multiple ways of accessing housing for people who are living with homelessness. But with coordinated entry, people are sort of funneled to the right place and are able to achieve housing at a more efficient and equitable rate. So the first series of slides will talk about our coordinated entry system more broadly, and then we will go into some details on how our system is set up. So some of this should look familiar if you were able to view the HUD training, but we will review just again to make sure we're all on the same page coming in. So a coordinated entry system is a community-wide system that prioritizes the most vulnerable consumers. Each CoC gets to determine what their system looks like based on their own local needs. However, of course, all CE systems should integrate all of the components that HUD sees as important to a CE system. And we will most likely use the term CE to describe coordinated entry throughout the training. So if you hear us say CE, please know that we're talking about coordinated entry. If you hear us say CoC, what we're talking about is continuum of care. And essentially what a coordinated entry system does is to standardize the assessment process for housing and related service needs. And it is required by HUD, not just for programs that receive CoC funding, but also ESG funding as well. And it is highly recommended for housing programs that are not funded through CoC and ESG to also participate and collaborate in the CE system. So the purpose is to enable all homeless and housing service providers to collaborate on the homeless needs of the community, enabling rapid, effective, and consistent referrals to the most appropriate housing assistance available. It helps to, again, I mentioned the word equitable before, it helps to ensure fair or equal access to prevention, diversion, shelter, and housing opportunities. We had a consultant years ago who said this, and we continue he's gone. He's not in the role anymore. But we continue to repeat his words, and this is sort of his legacy to us. If HUD gave us all enough money to house everyone, we would not need CE. So essentially what it means is that we have scarce resources, and in order to ensure that they are utilized most appropriately, we use the CE system to make those decisions for us without using subjective bias as much as possible. Coordinated assessment is another thing you might hear. What's the difference between CE and CA? So CE is the system overall. A coordinated assessment is actually a tool that we use to determine the priority of consumers. And it is, again, unique to each community. So each community gets to determine what tool they use for this purpose. So here are the hallmarks of a CE system. The first is prioritization. So the tool makes sure that we have a way to determine who has the greatest need, and we prioritize them based on that tool or the results of that tool. A CE system should be low barrier, meaning that we're not screening out, we're screening in. There should be a focus on housing first. So housing first means that we house people quickly, and there's no prerequisites or requirements for getting housing. You get housed because you're homeless, that's it. Person-centered, which means that people should have a choice in what services they receive. Another hallmark is fair and equal housing access, meaning that everybody has equal access to the process. Excuse me. And lastly, that the process is standardized. And so what we will do is talk a little bit more about how Morris County achieves this through our own process. So our coordinated entry system we call No Wrong Door. What this means is that if you're experiencing a housing crisis, you should be able to go to any service provider in the county and be directed to the CE front door, quote, front door. We've designed our system with certain values in mind, and we're always striving for these values. The first is that we try to be transparent, meaning that the process is clear and consistent and open for review and feedback. The second value is that we try to be accessible, meaning that anyone experiencing homelessness or is at risk of homelessness can access the system regardless of race, ability, socioeconomic status, documentation status, sex, gender, or any other reason. The third value is that we try to be client-centered, meaning we focus on the experience of the client through the system and work on ways to minimize harm and re-traumatization. And the fourth value is that we try to be collaborative, meaning that we have a wide network of providers and community stakeholders that inform our policy and process. So the current structure of our Morris CE system is that we have a program manager that we fund through CoC funding called NJ211. NJ211 is responsible for conducting the coordinated assessment screenings, for advertising the program, for managing the wait lists, and contracting with service providers. 211 contracts with 2 service providers to provide housing navigator services. These are Family Promise and the Mental Health Association of Essex and Morris. So what they do is they provide the highest priority CE clients who are not connected to other providers with housing navigation resources, including voucher paperwork and documentation assistance, voucher briefing and search assistance, and connection to resources. Their goal is to get priority households ready for a voucher award. We also have coordinated entry case conferencing committees. So we have 2 branches of case conferencing. The first is the coordinated entry, which reviews the top priority people on the wait list for voucher resources who are currently homeless. The second case conferencing committee is the coordinated prevention branch, which reviews cases, and these are not yet prioritized. We do not have a prioritization system. This is just if you are having a housing crisis and you're not yet homeless, your case is reviewed in coordinated prevention. So right now we have over 15 providers who have signed confidentiality agreements. So I'm going to turn the next group of slides over to Maria, and she is going to go over the coordinated entry actual process from a client perspective, how they see the process and how they move through the process.
Okay, great. So this is kind of just an overview of how to refer clients to CE, but broken down into simple steps. So like Allison said, there's a couple of different branches to the coordinated entry system based on what your homeless status is, right? So we have literally homeless households, and then we have households who are at risk or imminently homeless. So regardless of where you fit in terms of homeless definition, your first step into accessing shelter, housing, and prevention resources starts with just dialing 211. And the great thing about dialing 211 is that you can do it independently, or you can do it with a trusted case manager, social worker, or staff person. So we have plenty of partners in the coordinated entry system that actually assist households for the first time, or maybe when they experience a repeat episode of homelessness, actually call 211 to do that screening. So some support in doing that. From there, 211 will conduct an assessment based on what that household's homeless status is for prevention, shelter, and or housing waiting lists. During business hours only. So this piece is particularly important, and the coordinated entry system has kind of changed in different procedures along the years as we develop it and build it out and figure out what best practices are. So 211 is not going to conduct a full assessment for coordinated entry in the middle of the night, right? When somebody calls and they're homeless in the middle of the night, the priority for them is figuring out where they're going that night. So that is what 211 prioritizes after hours. So they do not do coordinated entry screenings during the evenings or non-business hours for that reason. So when clients call 211, they have the opportunity to select a homeless prompt after they select which language they're comfortable in, listening to all of the prompts on the recorded line. And then they select the prompt for Morris County. I think they type in the first three letters to get Morris. And then once they're on the phone with a 211 specialist, they can express what it is that they need, right? So clients have the right to self-determination and to advise on what services are appropriate for them. So they can express their current housing situation, what they're looking for, and what they need. If someone is absolutely opposed to going into shelter, it would not be appropriate to add them on a shelter waiting list, right? So the 211 specialist kind of gets a handle on what that person needs when they're calling and what they want to be considered for. They're screened appropriately that way. If a client is imminently homeless or at risk of homelessness, the prevention screening is conducted, and that person is connected to prevention resources. A really important first prevention resource is legal services, just to see if that situation from a legal standpoint can be avoided. And then if a client is literally homeless, a shelter housing screening can be conducted, and the client will have the choice in being added to a shelter and or permanent housing voucher list. Diversion resources can also be offered across the system as well, depending on what's appropriate for each household that's calling in. And then, like I said earlier, if a household is calling after hours, a coordinated entry screening is not conducted because the priority would be to address the immediate housing need if there is one. Allison, if you can go to the next slide. Thank you. So our process maps, I can bring those up. Would I be able to share my screen, Allison?
You can, I can bring them up too. I just need to pause the share.
Okay.
Hang on one sec. Okay. So the first one I have up is the how it goes from the call specialist.
I'm not seeing it. I don't know if anybody else is.
Oh, darn. Oh, hang on. It says resume share. Nope, it's me and my poor ability to use technology.
Yeah, now I can see it. Thank you. And you know, these process flows that we have, so we have two of them. The one that Allison has up right now is the flow for the coordinated entry specialist, which is the 211 call specialist doing a screening with a household that's calling in. And then we have another process flow that is specific to homeless placement. So if somebody is calling and they're homeless or imminently homeless, what does that look like? It looks pretty complicated when you bring this up. And if you're not super entrenched in the coordinated entry process, it could be a little intimidating. But I think it also speaks to the complexities of how these screenings are conducted and the efforts to really ensure that as a community, we're directing people and households to the right services and to critical services. So for this specific flow, you will see the process that we just talked about with a household calling in to the dedicated Morse coordinated entry line. First 211 screens for any domestic violence or intimate partner violence. And if a person is actively fleeing domestic violence or any type of violence, they are referred immediately to a victim service provider. We would never want to put a household on a coordinated entry waiting list that is actively fleeing. So that information is immediately kind of routed to an appropriate victim service provider. The coordinated entry specialist also completes a suicide risk screening. It's always important to check in with a household to see what type of state they're in when they're calling for homeless resources. Of course, it's common to get calls, as you all know, working in this field, that the first priority when talking to a household is addressing any safety concerns that are presenting at the time of that call. So that's exactly what the coordinated entry specialist does. And if the client is at risk for suicide or even homicidal behaviors, the appropriate referrals are made at that point. Let's say for most of our screenings, that person or that household is not actively fleeing from a domestic violence or violent situation and is not a risk for suicidal or homicidal behavior at that time, then the screening progresses and the coordinated entry specialist collects some demographic data from that household and enters it into their database. A verbal consent is reviewed with that household. The client has the choice to either provide consent or to not provide consent to move forward and have certain information shared. And then the coordinated entry specialist will upload that data that's collected into the homeless management information system where we track all of our coordinated entry data. And they will then start with the homeless management information system intake. We had a COVID screening tool or COVID questions at the time of the COVID pandemic. So any relevant questions would have been asked at that point. And then the client is gauged for being literally homeless or at imminent risk of homelessness. And at that point, the screening branches, right, into one of the two appropriate branches of the system. So if a household, for example, is going to be evicted within the next week or so, or within 2 weeks, the coordinated entry specialist would then complete the prevention tool to see if that homeless situation can be prevented and if resources can be offered to that specific household. And then if the household presenting is literally homeless, and that's HUD's definition of what it means to be literally homeless. So for those of you who are not super familiar with that definition, that is sleeping in a place that is not meant for human habitation. So that could be maybe a train station outside, a place that does not have running water, such as a place that's condemned or an abandoned building. It also counts to be in a shelter program that meets HUD's definition of literal homelessness, or if you're in a hotel motel paid for by another agency. So things that aren't considered to meet the definition of literal homelessness is if you're self-paying at a hotel or motel, if you're couch surfing, if you're staying with friends or family. Those are things that, per HUD's definition, do not make you literally homeless.
What?
So, was somebody trying to say something, or did I imagine that? Okay, maybe it's just myself echoing, sorry. So at that point, the coordinated entry specialist would see if that household can be diverted, any appropriate diversion resources could be offered. The specialist will make a determination if the call is after hours. If it is after hours, they are focusing on that immediate homeless need. And then the Office of Temporary Assistance, for all homeless hotline calls that happen after hours, follows up with each of those homeless callers on the next business day to see what their full housing and homeless situation is and make appropriate referrals from there. So if the call is not after hours, the specialist would proceed with determining if the client or the household calling is interested in shelter and or permanent supportive housing options. From there, and I don't want to get too far into the weeds, they would do the coordinated entry assessment tool, the prioritization tool, which we're going to talk about a little bit further in just a minute. And they would also make appropriate referrals for that household at that time. The coordinated entry specialist utilizes their screening tool, and then they place a household on the appropriate waiting list. So if someone is calling from a shelter program, they wouldn't be adding that household onto a shelter waiting list, but maybe that household is interested in a voucher opportunity. So that household would be added to the voucher waiting list. You can be added to both if you're street homeless and you're open to both shelter and permanent housing opportunities. You can be added to both lists. And then the household is always instructed to call back 211 if there are any changes to their situation, right? Because it's a priority tool screening. So if they were, for example, in a shelter program at the time of their screening and they suddenly become street homeless, that would be something important to call back and inform the specialist about, because there's different opportunities that would be available to that household in terms of shelter and housing at that time. So that's a broader overview with some specifics of how the actual flow of coordinated entry works when a household calls in to do a screening. Of course, when we made these process flows as a leadership committee, I think a couple years ago at this point, we had the understanding that coordinated entry is this big evolving system where we constantly have different housing and shelter programs enter the system, and we therefore need to be flexible as to what the different options are and create a flow where we can add different housing opportunities into that mix and assess for them. So when we look at the actual homeless placement process flow, same thing. This is a flexible process. Rapid rehousing was not a popular housing option in Morris County at the time where we developed these process flows, but now we do have rapid rehousing opportunities. So there is a portion on this specific flow where it actually leaves room for there to maybe one day be a separate rapid rehousing waiting list. Right now, clients who are on a shelter or voucher waiting list could be eligible or screened for rapid rehousing programs. So it still fits within the system. We just don't have a subset list for that type of housing. So at this point in the process, the coordinated entry specialist would inform a household that they've been added to whatever appropriate waiting lists of their choice and based on their housing and homeless status. The coordinated entry program manager, which is Marco, he's on this call, he's wonderful. He reviews the waiting list clients daily, monitors the list with his team over at 211. The coordinated entry program manager assesses the need for care management or housing navigation, which is what Allison was talking about with MHA and Family Promise. And that is a process that happens fast because we want households to be immediately connected to a service provider if they're not already working with one. If somebody is already working with a case manager, let's say at Nourish, they're working with Dom, or maybe they're assigned an OTA worker and they wouldn't need an additional housing navigator, that's fine. They don't need to be assigned to a housing navigator. They're pre-connected, right? They're on the proper waiting list. When a opportunity becomes available for housing, they're scored on that list by their priority. So I'm going to try not to get into all the complexities of what you guys see on your screen right now, because I think we'll just dive into the weeds if we do that. So when someone's already connected to a service provider, they're on the waiting list, that service provider has access to what their screening indicates. They have access to see how that household responded to questions in the assessment tool. And if there's tweaks that need to be made, that's a fluid conversation that happens between providers and the program management entity, which is 211. So for example, my client, John Smith, did a screening with 211 and was added to a shelter list. And I see that he responded that he does not have a mental health diagnosis, that he does not have a physical disability, but I know with certainty that those two answers that he gave to those questions are incorrect and impact his priority score. So that would be something as his social worker that I would report to 211 so that he is ranked more appropriately in priority status on the waiting list that he is coming up on. Same thing, if a housing navigator engages with a household that is added to a waiting list, engages with that household for the first time, that household is not working with any other service providers, and maybe that housing navigator learns of inaccuracies that the client reported in their assessment screening, or they just find out some more information. It's a fluid process to be able to change those answers to get that client ranked appropriately in terms of priority. And then whether you're a service provider or a housing navigator working with households that are on the waiting list, our joint goal as providers in coordinated entry is to get our clients to a point of being housing ready when voucher opportunities become available. So having things like an ID, having a mailing address, having proof of certain documentation that will be asked for voucher and permanent housing opportunities. So as case conferencing teams, we're constantly looking at the waiting list together as committees of service providers. We're looking at people who are the most vulnerable on these waiting lists, and we're trying to get them to be housing ready for when opportunities open up. So they're ready to go to a briefing for a voucher award. They're ready to apply for a housing opportunity when those become available, and they're already engaged with the service provider to guide them towards self-sufficiency. So at our case conferencing committee meetings, which I think we're also going to go into a little bit more of what those look like, we're talking about housing and shelter placements. So we have these 4 opportunities open for vouchers. Let's look at the most vulnerable households on our waiting list and make referrals and figure out who's helping those households get in their paperwork to be eligible for that voucher opportunity. If a person is accepted for a housing opportunity, they are removed from the waiting list that they're on as appropriate. And a lot of shelter and housing providers that work within the homeless management information system can directly clone and admit households from a coordinated entry waiting list into their homeless management information system program. So if Homeless Solutions is assessing, for example, a household for shelter that's on the waiting list, they can admit that household directly into their program electronically, and that household would be pulled from the coordinated entry waiting list. I'm hoping that kind of sums up this process. There's a lot of little steps in between, but I think the most important part is when a household is added onto a waiting list, there's either a connection established with a housing navigator, or it's identified that by the program manager, but that household is already connected to a Morris County service provider. That provider works with that client, ensures that their screening information is reported correctly, and the case conferencing committees get together and make decisions for housing referrals and housing placements, all within the system. And then the system in turn is updated accordingly based on admissions into housing and shelter programs. So those are our 2 process maps, or flows as we like to call them.
Can you see the screen again?
Yeah, I see process maps.
The power.
Okay, so here's a little bit more detail on the branches of coordinated entry that we've been talking about. So the shelter and permanent housing branch is for the literally homeless households that are calling in to be screened within our coordinated entry system. And it's that HUD definition that I explained a little bit earlier. The only exception to this definition for our Morris County coordinated entry system is TRA clients from the Office of Temporary Assistance. And these are clients that are households that are receiving temporary rental assistance that don't necessarily meet literally homeless status by HUD definition, but still have a longer term housing need. The assessment screening is basic. We've actually modified the assessment screening for coordinated entry several times, just through like the lived and learned lessons of doing coordinated entry for a few years. We have it set up now so that we're really only asking about household vulnerabilities and assigning scores to those vulnerabilities to appropriately prioritize households for housing and shelter services. The waiting list that we have for those that are literally homeless and that fall within the shelter and permanent housing branch of the system are as follows. We have 3 shelter lists, which really help the shelter providers identify by household size which list they're looking at for admitting a household into program. So there's a singles shelter list, there's a couples shelter list, and there's a families shelter list. They all do the same screening. It just breaks them out by household size. And then there's a voucher and permanent housing list, which is our biggest list. And when households call in to do a coordinated entry screening, they have the option or the choice to be on a shelter list and or a voucher list, which I touched upon before. The households that call in aren't necessarily told that they have to be on a list. They explain their situation, they explain what options they're interested in and willing to pursue, and then the coordinated entry specialist adds them to the appropriate waiting list that way. And I think it's important to note here that Marco, who is the current 211 program manager for CE, he actually reviews the assignments of households being added to waiting lists just to ensure another layer of quality assurance that each household is added to the appropriate list. So that's great, and that happens ongoing. And then we have the prevention branch, which is for the at-risk or imminently homeless, group of callers that would be calling to do an assessment. And that assessment screening differs from the priority screening tool that we use because there is no priority score. The questions that are asked are a little bit different to gauge for prevention resources in the community. And that's one waiting list. So the prioritized coordinated entry assessment tool is only a couple of questions, which is exactly what you are all seeing on your screen. And I think, Marco, you can totally correct me if I'm wrong. I think the maximum score a household can get is between 16 and 17 points. And the layers of questions that we ask is we start out with the current housing situation, right? So where did you sleep last night? And then based on that answer, that person is assigned a score for that specific question. And I believe that is a max of 10 points for the housing situation question. So someone might respond, I slept in an abandoned building, or I slept at Homeless Solutions in their emergency shelter program, or I slept in a motel paid for by the Office of Temporary Assistance. So all of those meet the HUD definition of literally homeless. And then there's also priority layers to, to those responses for homeless status. So if you're chronically homeless, you're the highest priority on our coordinated entry waiting list. If you're street homeless, that's medium priority. And then sheltered homeless is the lowest priority out of all of the literal homeless options. So those are ranked accordingly in terms of priority score. And that's kind of how a max of 10 points is assigned within that question. So I don't want to make it too complicated, but there's different layers to the housing situation and how each housing situation is assigned a priority. And then we go on to barrier questions, which is, have you ever been convicted of a crime? Do you or anyone in your household have a developmental disability, a physical disability, maybe active or current substance abuse, a diagnosis for a mental health concern? And then we finally ask the pregnancy question. In all of those barrier questions, you can get a point for if you're responding yes. So the intent here is to screen a household for their vulnerabilities to identify their priority on a coordinated entry waiting list. because we serve the highest priority households first. So if John Smith does this screening, he slept in an abandoned building last night. He has been convicted of a crime. He has a physical disability. He has a active substance abuse history and is currently using. He has a mental health diagnosis. He is going to be ranked quite high on our voucher waiting list, for example, as next in line for a voucher opportunity, because we're serving our most vulnerable community members first, compared to somebody who maybe slept at a hotel last night that was paid for by the Office of Temporary Assistance, and maybe has never been convicted of a crime, has no developmental or physical disabilities, does not have a mental health concern, is not actively using, has no pregnancies in the household. That person is going to have a priority score that's lower than that initial person who has all of those barriers contributing to their homeless situation. And then we have our coordinated entry partners. So the providers that participate in coordinated entry, I think Allison mentioned a little bit earlier that we have around 15 different partners right now, which has grown immensely over the years. I think coordinated entry only started out with a couple of agencies, and now we're up to 15. So a coordinated entry partner could be a shelter provider, a rapid rehousing provider, permanent housing provider, any type of supportive service provider, diversion provider that is offering services to the homeless population. We also have different stakeholders and what we call coordinated entry friends who participate in our higher level meetings when we're talking about the coordinated entry system. So there are a couple of levels to engagement within the coordinated entry system. The first being a MOU partner. And what a MOU is a memorandum of understanding. So we have many providers in the coordinated entry system that have signed on to this MOU. And what the MOU is, it kind of clarifies what the purpose of coordinated entry is, a description of what the key qualities of a coordinated entry system are that Allison initially reviewed. It kind of solidifies what a collaborating partner's responsibilities are. So, promoting the coordinated entry system, participating in meetings that we have, being engaged in the process in the system, participating in things like training. So those would be all the responsibilities of someone who is a MOU partner in coordinated entry. It's an organization that would provide specific housing or supportive services to households in coordinated entry. And then as a stipulation of that, those partners would be doing training for coordinated entry like we're doing today. They would be attending high-level system coordinated entry meetings that we have every month. They would be offering resources or maybe beds or vacancies to coordinated entry waiting list clients and households, and they would be signing that MOU agreement. So that's what it means to be an MOU partner. We also have case conferencing partners. And for case conferencing partners, they're eligible to participate, same thing, in these high-level system coordinated entry meetings where we talk about, different housing updates. There's housing inventories in the community. There's moratorium and housing opportunities that are announced community-wide. There's agency updates that we talk about. We talk about the policies and procedures of coordinated entry and what recommendations we can pose to coordinated entry leadership committee members and the CoC executive committee. So those are kind of the higher level discussions that those partners can also participate in. And they similarly would complete coordinated entry training. They would attend these high-level system meetings. They could attend case conferencing meetings, which is really getting down to the nitty-gritty. What are the shelter and housing opportunities we have in the community? And let's make referrals and talk about those clients that are eligible for them. And of course, the most important part is the case conferencing partners that are case conferencing about clients within the system have to sign a confidentiality pledge. So each individual that participates in case conferencing has to complete a confidentiality pledge. So even if their agency did an MOU, each individual staff person needs to do a confidentiality pledge, which is an agreement to adhere to confidentiality standards of the system and to safeguard client information. We have another partnership level, which is the advisory board committee members, and their role is to have active membership in the coordinated entry system for the purpose of advising on the coordinated entry process, needed improvements specific to lived experience. So individuals with active membership on the advisory board subcommittee of the CoC are eligible to observe coordinated entry case conferencing meetings and higher level meetings and provide feedback on the coordinated entry process specific to the leadership team and the advisory board committee liaison. And they too would complete prescribed training of the coordinated entry system that we're doing today. They can attend high-level meetings and case conferencing meetings, and they would also be signing a confidentiality pledge as well. And then finally, we have what we call a CE friend, and that could be a representative of a service organization, or it could be a stakeholder, community member that have not yet met MOU partner criteria or case conferencing criteria, but can still participate in high-level system conversation about coordinated entry. So we have maybe one or two of those right now within our current coordinated entry system. And then, so just a quick comment on programs that funnel through coordinated entry. So sometimes the state and federal government initiates housing programs with permanent housing opportunities that often require coordinated entry compliance. So we recently actually saw that with the Department of Community Affairs, their emergency housing voucher program and their rapid rehousing voucher program. So they rolled out these really large, colossal housing voucher programs, and they had a stipulation to those programs that applicants had to be a part of each community's coordinated entry system. So this is another reason why it's so important for communities to have coordinated entry systems, because when these big programs come through the state and federal government, we're prepared to get people housed, specifically in Morris County. So we were able to successfully participate in the emergency housing voucher program, and we were able to participate in the rapid rehousing voucher program to get Morris County residents served. So I just want to mention that, because even, you know, programs that are not necessarily CoC or ESG funded, they do sometimes still require compliance with the coordinated entry system, and it allows us Morris County service providers to ensure that we're offering all possible housing opportunities to our clients. So the MOU and pledge that I was talking about, we can bring up. Oh, thank you, Allison. That's great. So like I said, it's a very basic memorandum of understanding. It really just talks about what the purpose of the coordinated entry project in Morris County is, a description of coordinated entry, which is what we're all here talking about today. It then goes into the roles and responsibilities of partners. It talks about key qualities of what our coordinated entry system is. And yeah, you can see right now on the screen that these are some of the partner responsibilities that I mentioned, sitting on case conferencing, promoting coordinated entry, giving clients of your agency information about how to access coordinated entry. These are all the basic expectations and responsibilities of collaborating partners in the system. So very basic, it's not meant to be super complicated, and that's what the MOU partners sign on to. And then we have our one-page confidentiality pledge, which was mirrored off of a confidentiality pledge used in a couple of other communities with coordinated entry system. And it goes into just the basic agreement to keep participant information confidential. And each individual staff person participating in any coordinated entry work group with case conferencing needs to sign one of these pledges to participate. So we keep track of all of that internally. So here is a list of our current coordinated entry partners. Some of the starred ones you'll notice are just ESG and CoC funded providers, which there probably needs to be a couple modifications to this. But you'll see that it's kind of far reaching in terms of the services and the types of providers that we have. So we're really fortunate in our coordinated entry system to have several housing authorities that participate, which means we're actively talking about clients who are vulnerable and in need of a voucher. And it's great to have them at the table for when their waiting lists open up for vouchers. And then we have other service providers listed on here, like Edge, Roots and Wings, Visions and Pathways, Legal Services, Norwest CAP, Salvation Army. So a combination of shelter providers, housing providers, government organizations, nonprofits, and then social service agencies that target specific populations within the homeless community, whether that be youth, whether that be households that identify in the LGBTQ plus community, whether that be clients who are veterans or in need of veteran services. So our range of providers is quite far-reaching right now, which is great. We're very diverse. And then Allison, stop me if I'm going too far, because I don't remember which ones you said you wanted to do. I can keep going. I don't have a problem.
That's okay. Yeah, no, a couple of slides ago, I was supposed to take over, but that's okay. You've been doing such a beautiful job that why would I stop you?
That's so funny. Okay, jump in. Feel free.
That's okay. I can bring us home, I think, anyway.
Right.
Because we are almost done. So we've talked already about from the client's perspective, how they see the system, how providers are engaging in the system and stakeholders are engaging in the system. So last, we're going to talk about how sort of decisions are made. We already talked about case conferencing committees. We're going to talk about them again in this context. So how do we manage the CE system? On sort of the top level, obviously, always is the executive committee. The CoC executive committee is what makes final decisions about all things coordinated entry, in addition to all the other aspects of the system. But in order to inform the CoC on those decisions, we have a CE leadership committee. So a CE leadership committee is rather small. We have somebody from the lead agency, which our lead agency is the County of Morris. So a staff member, at least one, sometimes two staff members from the lead agency will attend CE leadership meetings. We have leadership from the CoC executive committee attending these meetings. The lead chair from the case conferencing committee for coordinated entry and the case conferencing committee for the coordinated prevention. Somebody from the CoC consultant and a member of the advisory board. The responsibilities of the leadership committee are to review reports and recommendations made by the program manager and the case conferencing teams and other stakeholders to address system barriers and make recommendations for system level changes, and then ensure the quality and efficiency of the CE system. Case conferencing committees, we've talked about at length. They are led by both a lead chair and a co-chair. The lead chair is someone who does not represent a CoC funded provider and acts as a liaison with the CE Leadership Committee, prepares reports, and manages projects. The co-chair schedules and facilitates regular case conferencing meetings, tracks attendance, manages correspondence, and communicates resources and updates. Their responsibilities of the case conferencing committee is to advise on housing barriers and propose solutions, do client advocacy, and attend regular meetings, accepting referrals for services, housing services, case management, and program intakes. And then under case conferencing committees, we occasionally have case conferencing work groups that pop up. So an example of this would be our shelter work group, which meets to coordinate specific housing types. And then these work groups report to the case conferencing committee. So tips we want to remember: homeless status, or the definition that we've referred to a few times, the HUD definition matters. Understanding coordinated entry helps to guide your clients and reduces stigma in seeking services. Clients without access to a phone can utilize a phone at a provider's office at a drop-in center location to get screened. Clients may misrepresent or conceal information if they're screening that impacts their priority score. So it's important to report errors to 211 when you're assessing your clients. That is it for our presentation. We will open it up now for Q&A. I'm looking at the chat box. I only saw one question. Can a copy of this be provided to participants? I think you meant the process map. And what I can share is the Morris County CAS webpage. What we've started to do recently is compile coordinated entry policies and procedures and information on here as a centralized location. The process maps are not up yet, but they will be. We're in the process of uploading everything. So today's training will be located here after today. Here is the training that we are requiring in addition to this training. You can link to it right here. And then there will be process maps and policies that all things that have been approved by the CoC will be located here. So I've got about 70% of it up, I think, at this point. I think there's a few more documents that we need to upload, but everything that we share today will be uploaded to this site. So make sure that you check out our CAS webpage. And then if you go up to the top, it would be under CoC policies and procedures, coordinated entry. Were there any other questions?
Just a comment. I just want to thank both of you for a really thorough presentation and, kind of going through all those details without trying to go too much into the weeds. I know it can be easy to do that. So I appreciate, how concise it still was and detailed and giving an overview of that whole system and how it interacts. So I appreciate that.
Thank you, Casey.
Thank you.
Great. Thank you very much, everybody, for being here today. We appreciate your attendance and your attention. If you have not yet done so, please go ahead and take a look at that HUD presentation. Both this training and the HUD training are required for participation in coordinated entry. So we hope that you go ahead and get that done early as possible. It's 90 minutes, right? So you may have to take breaks, 20-minute chunks or something at a time, which I highly recommend for any HUD video. So Thank you so much. Have a great rest of your day.